Hi, I'm Dr. Robert Slaman, board-eligible plastic surgeon here in Northern Virginia and Washington, D.C. My practice is built on the philosophy of precision, artistry, and uncompromising care. Rhinoplasty is one of the most intricate and transformative procedures I perform. Today, I'd like to share with you the fundamentals of nasal anatomy, the different approaches to rhinoplasty, and how modern techniques create results that are both beautiful and functional. Now, let's delve into the art and science of rhinoplasty, often called a nose job, but truly so much more. Rhinoplasty bridges beauty and function. Cosmetic rhinoplasty refines the nose's appearance, perhaps softening a dorsal hump, narrowing the bridge, or defining the tip to harmonize with your facial features, creating timeless elegance. Functional rhinoplasty, on the other hand, addresses breathing issues, such as a deviated septum or enlarged turbinates, restoring effortless airflow while preserving or enhancing aesthetics. Often, these goals intertwine. For instance, correcting a structural deviation can simultaneously yield a more symmetrical, refined profile. I prioritize both, ensuring your results are not just beautiful, but life-enhancing, allowing you to breathe freely and radiate confidence in every setting. To appreciate rhinoplasty, understanding the basic nasal anatomy is key. The nose is a masterpiece of form and function, divided into 3 vaults. The bony vault forms the upper third, comprising the nasal bones that provide structural support and shape the bridge. Think of it as the foundation of your nasal architecture. Moving downward, the cartilaginous mid-vault, or middle third, consists of oral cartilages, which connect the septum and maintain the nose's midline stability. This area is crucial for preventing collapse and ensuring smooth contours. Finally, the nasal tip, the lower third, is crafted of your lower lateral cartilages and soft tissues, dictating nasal tip projection, rotation, and refinement. The bony vault forms the upper third, comprising the nasal bones that provide structural support and shape the bridge. Think of it as the foundation of your nasal architecture. Moving downward, the cartilaginous midvault, or middle third, consists of the upper lateral cartilages, which connect to the septum and maintain the nose's midline stability. This area is crucial for preventing collapse and ensuring smooth contours. Finally, the nasal tip, the lower third, is crafted from the lower lateral cartilages and soft tissues, dictating the nasal tip projection, rotation, and refinement. Imbalances in any of these sections can affect both aesthetics and airflow. In my practice, we approach each element with surgical precision, respecting your unique anatomy to achieve balanced, natural elegance that complements your heritage and your aspirations. When it comes to surgical approaches, rhinoplasty offers 2 primary methods, open and closed, each selected based on your needs for optimal results. The closed approach involves incisions hidden entirely within the nostrils, allowing access to reshape the tip of the nose without external scars. Ideal for simpler refinements where minimal dissection is required, promoting faster recovery. In contrast, the open approach adds a small, discrete incision across the columella, the tissue between the nostrils, providing unparalleled visibility and control in the operating room. This method excels for most cases, enabling precise grafting and restructuring. The choice of technique depends on your anatomy, your goals, and the complexity of correction required. Finally, let's touch on preservation techniques. This is a revolutionary evolution in rhinoplasty that honors the nose's natural integrity. Unlike traditional methods that may involve extensive removal of bone and cartilage and elevation of soft tissue, preservation rhinoplasty focuses on conserving dorsal ligaments and structures, gently reshaping the nose rather than reconstructing it. For example, in dorsal preservation, we lower the dorsal hump by removing the bone at the base. This allows you to keep the dorsal lines intact, reducing swelling, bruising, and recovery time. This technique yields incredibly natural outcomes, minimizing risks like irregularities and preserving your nose's authentic character. I integrate these advanced methods to offer you results that feel inherently yours, with minimal downtime, allowing you to return to your lifestyle swiftly. Recovery is an important part of the journey, so let's talk about that. Most patients return to work and social activities within 1 to 2 weeks, though swelling continues to refine for months and sometimes up to 2 years. My team and I guide you every step of the way with detailed instructions, concierge-level support, and follow-up care designed to ensure a smooth, comfortable healing process. The main procedures that I recommend, rhinoplasty is often complemented by adjunct procedures. The two procedures I often recommend that will create overall harmony to the face are a lip lift and a genioplasty, otherwise known as a chin enhancement procedure, that can bring proportional strength to the jawline. When thoughtfully combined, these procedures enhance the face as a whole, creating results that are natural, balanced, and timeless. In essence, rhinoplasty is more than a procedure. It's a curated journey to your best self. With meticulous planning, modern techniques, and a concierge level of care, I'm committed to delivering results that are elegant, functional, and enduring. If you're ready to explore how we can refine your profile with world-class precision, I invite you to schedule a private consultation. Visit slamandplasticsurgery.com or speak directly with our staff at the front desk. Thank you for joining me today. Here's to timeless confidence.
So when we talk about migraine surgery, it is important to choose the right patient. Patients who are good candidates are people with diagnosis of chronic migraines. So typically they have already seen a neurologist and they have a diagnosis of chronic migraine. What does it really mean in real life? That means you're suffering from headache more than 50 times of the month. So 15 or more headaches per month for more than 3 months. And again, you would have had to have a neurologist diagnose you formally with it. They also should have tried all the medical therapies that are available to them, meaning multiple medication, things like triptans and such, and the medications is not controlling the headache adequately. So think of migraine surgery as carpal tunnel surgery of the head. The goal of migraine surgery is to go in surgically and release any structures, and that could be things like tight fascia or sometimes even blood vessels that are constantly beating against and restricting the peripheral nerve, therefore triggering migraine headaches. So my goal for the surgery is to go in, identify that trigger point where the nerve is being constantly irritated, and then clearing out the structures around it so that the nerve is not so irritated anymore. So I'm glad you asked that question because the word success in migraine surgery has a very specific definition. We deem the surgery successful if you have 50% reduction in both a combination of the severity of the headache as well as frequency of the headache. Keep in mind that the surgery is meant to be long-lasting. However, there are times where a secondary trigger site may emerge after I treat your primary trigger site. So the surgery is the same-day surgery, meaning that you go home the same day. You may have some bandages or dressings over the surgical site. It is really important that you control your swelling afterwards, so I will probably ask you to do some cool packs or ice packs for the first 48 to 72 hours. You'll see me back in clinic about 5 to 7 days. There may be some sutures that may have to come out at that point. And then I'll see you again in another week or two. At that point, I'll be able to assess how everything's healing. Typically, people take somewhere around 2 weeks off work for it. Some may go back to work a little bit earlier, depending on which trigger site that I release. And then it'll take about 4 to 6 weeks until you're back to full activity without restriction. So sometimes people actually have headache the day of the surgery. So don't be surprised. That is pretty typical. But a lot of people will notice difference in the first 6 weeks. However, keep in mind that the full results may not be noticeable until you're a few months out.
Hi, I'm Dr. Slamman, and today we're going to talk about the 5 things that I usually talk to patients about before surgery. There are often things that people don't think about. All right, so the first one is I would recommend that all my patients stop smoking for at least 6 weeks before surgery and for 6 weeks after surgery. But the reason behind this is that because as plastic surgeons, we work with the skin, and smoking cigarettes or even other tobacco products or vaping really does limit the blood supply to the skin. So it puts you at an increased risk of wound healing complications and infections. So that's a big no-no. Number 2, because we're working with the skin, really important to optimize the skin as much as possible. Okay, so if you don't have a basic skincare regimen, I recommend starting it as soon as possible because it helps with all different procedures. As basic possible skincare routine is moisturizers in the morning and night, a moisturizer with SPF, ideally a zinc-based or mineral-based SPF in the morning, regardless of what it looks like outside, is going to protect you from those UV rays that help us age quicker. After the moisturizing and the sunscreen, the next best product is a good quality vitamin C tincture or ointment, and that is usually applied at nighttime. So that's kind of the simplest possible skincare regimen. The reason I recommend that ahead of time is because, again, we're working with skin, and if you can boost the quality of your skin, it will help with the eventual scarring. Because if you imagine, you're just optimizing the template with which we're working on. So another good option is any sort of retinol product, because that thickens the dermis, and that's where we put all of our stitches. So number 3, we all know life can be stressful, and some of us struggle with anxiety and depression. Especially after surgery, these symptoms can flare. You're not looking the way that you expect because it's early in the recovery process. You're in pain, you're not moving, and we all know that moving makes us all feel better. So it's really important that if you struggle with anxiety or depression, that we have everything optimized before surgery so that you're in the best mental and psychological space as possible on the day of surgery, and that will set you up for a great recovery. Number 4, this is a fun one. I find that pineapple really improves or limits the amount of bruising that you have after surgery. So what I recommend is just a glass of pineapple juice, ideally organic pineapple juice with, no added sugar, something from, a Whole Foods or a good quality product, and do that for about a week before surgery. And that has compounds in it that will limit the amount of small microbleeding that you have at your surgical site, and then that limits the amount of bruising that you. Number 5, let's lay the groundwork for recovery by optimizing your general health. So I consider it training for surgery. How do we do this? By eating as best as possible and exercising as much as possible. I'm a plastic surgeon. The biggest joy in my life is to make you feel amazing, and surgery does that. But more importantly, these long-term habits of eating well and exercising daily will make you feel great and will keep your result as long-lasting as possible. Why is this? Because if you're in a healthy state through good exercise and good nutrition, you have high quality skin, and we already talked about how important that is to scarring and healing. So those are 5 specific things I recommend to patients before surgery. But I find that the most important thing is a very detailed conversation with your surgeon about expectations after surgery. That way you're going in with a clear view of what you should expect, what you're going to look like, what you're going to feel, and the things that you can do each day to get yourself better faster.
Hi everyone, my name is Dr. Rachel Park. I am a plastic and reconstructive surgeon here in Northern Virginia with the Affiliates in Plastic Surgery Group. As a plastic surgeon, I have a lot of clinical interests, with one of very special one being breast reconstruction. It is extremely rewarding to me to help patients with a scary diagnosis of breast cancer or high-risk genetic mutation and help them go through their treatment journey right beside them. Now, when we talk about breast reconstruction, there are various options. And depending on what the plan is for your oncologic treatment, those options may vary. Let's start from the least amount of tissue removal. For women who are getting breast conserving therapy, which consists of lumpectomy, meaning that the breast surgeon will core out that cancerous tissue with a margin of healthy tissue around it, and then followed by radiation therapy, one option might be to perform what we call oncoplastic reduction or mastopexy or breast lift. This is an option where I can perform either a breast reduction or a lift at the same time as the lumpectomy, with the goal of providing more symmetry and aesthetically pleasing breast shape after your surgery. This is most often for women with some pre-existing degree of ptosis or excess breast tissue, as it allows women to have better shaped, more symmetric breast post-op. Now you can imagine if someone were to core out a chunk of breast tissue from one side of your breast, then you may, and even further, get radiation afterwards, which can affect the shape afterwards. You can imagine without it, you may have significant asymmetry afterwards. And in fact, previous studies have shown that there may be additional medical benefit in addition to aesthetic benefits to these type of procedures, where your chance of getting repeat lumpectomy may be lower with oncoplastic procedures. and this was actually published by one of my colleagues at UVA. If one were to get a more invasive procedure such as mastectomy, we have a few options. The simplest option will be what we call a Goldilocks procedure. Now, if we were to get a more invasive procedure such as mastectomy, we have a few options. The simplest option will be what we call Goldilocks procedure. Now, this is a procedure where I preserve some of the dermis and some subcutaneous tissue and create a modest amount of breast mound after mastectomy. Now, this is the best option for women with significant degree of ptosis and larger breast size. And if they were to tell me, hey, doctor, I don't want to get multiple surgeries, I just want one surgery and be done, but I'm okay with having modest size of breasts, then this is the right option for you. If one desires a more significant reconstruction, two major options will be either implant-based reconstruction or what we call tissue-based reconstruction, also known as autologous reconstruction or a flap, as we call it. Now, no matter which option you choose, most likely first step will be to place what we call a tissue expander. And this is done at the time of your mastectomy, where I place essentially water balloons inside of the breast pocket after the tissue is removed. This step allows us to keep the breast pocket open, and over time, it also allows me to fill and expand those water balloons or the tissue expanders to a point where I have nice size of the breast pocket that I can now then continue with the final reconstruction. Once your breast pocket is adequately expanded and the skin is healed well, and if you're getting radiation, you would go on to get radiation, and then after the radiation is all over, we can now then move on to the second stage, which will be either an implant-based reconstruction or autologous reconstruction. Now, let's briefly talk about implant-based reconstruction. These are the same implants that I will use if you were to get cosmetic augmentation. Now, there are many different companies, many different brands, different types of implants. I'm happy to discuss the different types with you at the time of your consultation. But essentially, what I would do is take out those water balloons or the expanders and then replace them with implants. Now, when I say flap or tissue-based reconstruction, also known as autologous reconstruction, it means that I will be using your own body part to recreate the breast mound. My primary option for this is typically your lower abdomen. So think of it a little bit like getting a tummy tuck, and instead of me throwing out those extra tissues away, I will be repositioning them to recreate the breast mounds. Now, this does require a very delicate surgical technique called microsurgery because we're working on something small. I do have to dissect out very specific blood vessels, so artery and vein, that feeds those lower abdominal tissue, and then reconnect them on your chest in order for those tissues to be healthy and survive. Now, this option may not be offered by all plastic surgeons because, again, it requires a very delicate, specific microsurgical training. And yes, it is a bigger, longer procedure that typically requires about 2 days of hospital stay afterwards. Initial surgery can last up to 10 hours or so. However, I think of it as paying for it up front. It is a larger surgery. However, it is a durable reconstruction that's really gonna stay your entire lifetime. You don't have to worry about having implants. You can have complications with implants down the road, things like capsular contracture, maybe implant rupture. Implant typical lifetime is about 10 years. So if you had reconstruction earlier in your life, then it may require revisions, multiple revisions down the road. And another thing is if you have radiation, implants just don't play nicely with radiation. So if you're asking, hey, I don't know which reconstruction is the right choice for me, typically if you weren't getting radiation, I would say you have more options. But if you are getting radiated afterwards, I would encourage you, especially if you're a right candidate for the autologous reconstruction, I would encourage you to really think about the flap option. And lastly, and importantly, secondary reconstruction is an option to consider. If you've had mastectomy many years ago without reconstruction, or you've had initial reconstruction but you are now kind of unhappy with it, there may be things that I can offer you. Especially, it's not uncommon for people who had initial implant-based reconstruction and now they have multiple issues. Maybe they were radiated initially, for them to come to me and then say, hey, like I actually am having a lot of issues with implants. Is there anything else that can be done? The answer is there's no expiration date for autologous reconstruction. So as long as you're the right candidate, even if you had one type of reconstruction earlier on, you may be able to pursue a different type of reconstruction that may be fitting for you a little bit better. These more innovative techniques include things like nerve reconstruction, where I can potentially try to preserve more sensation around the area where you had mastectomy, or surgical treatment for lymphedema. So this were to be if you've had breast cancer, mastectomy, maybe you had sentinel node or axillary dissection, and end up with swelling in your arm. I may be able to help you either in a delayed fashion, so after you've already developed swelling, or at the time of your initial surgery to try to reduce the risk of developing lymphedema down the road. Breast reconstruction journey is unique and different for every woman, and my job as a plastic surgeon is to listen to you and work with you every step of the way so I can create an individualized plan for you to help you feel like yourself again.
Good candidates for neck lifts are people who feel that they have a little extra skin or extra fullness in this, what we call submental area. This is the area underneath your jawline and your chin. So if you, even from the front on view or from the lateral or the side view, you have what people call like a turkey wobbler or a turkey neck, extra skin or extra fullness that you don't like if you're looking down. These are people who are great candidates. Yes, there are a few non-invasive options. So something I didn't talk about before is that a good candidate for a neck lift, some, not all, but oftentimes will have neck bands. That is a result of the edge of the muscle underneath the skin of your neck. It's called the platysma muscle. So these are called platysmal bands, and as we age, they get a little bit tighter. You can relax those bands through Botox injections. We do micro doses of Botox here in the office. You leave the office looking like you had nothing done, and with time, as the Botox takes effect, the neck will tighten and those bands will camouflage themselves. They don't 100% go away, but it's a big improvement without the need for surgery and the downtime associated with it. The second big non-invasive option is a chemical peel, addressing the sun damage and skin, the thin-skinned area of the neck and the upper chest. And I find that works really well with patients. Your neck lift, you're gonna leave the operating room with a big dressing. You're gonna have a drain coming out. Someone will drive you home. You're going to recover that day. I do want you walking that day of surgery. The biggest thing we want to prevent is blood clots. So if you could start walking right after surgery, that's the best thing you can do for any plastic surgery procedure. So that night you're going to be doing a little bit of walking. Hopefully someone can cook for you and you can just rest. Ideally sleeping with your head in like elevated position, either in a recliner or put, a wedge pregnancy type pillow behind your back to help keep you elevated. I often recommend that people use old sheets or change out their pillowcases to older pillowcases because you will have some drainage even outside the dressing. The next day, you're going to come back into clinic and see me, and we're going to check in with each other to see how you're doing. I'll remove the entire dressing and remove the drain. For men, you're still going to have the hemostatic net in place. That really helps define the jawline and prevent extra bleeding that happens in men. So those stitches that you're going to see on the outside are going to stay in place if you're a man for another week. But going back to the day after surgery, you'll just continue to recover, relax, walk around, eat a healthy diet, and that's going to be the case for the next 2 days. At about day 3 or 4, you're more than welcome to get back to digital work or remote work. I would do it lightly to start with. But by, 1 week after surgery, you can almost be fully back to work, especially if it's out of the workplace. At about 7 to 10 days, a lot of that post-operative edema and the extra tightness is going to start to relax. Most of the bruising should be going away. So you'll probably feel ready to go back in public about day 7 to 10, but everyone's a little bit different. Neck lifts last for roughly 10 to 15 years. I love neck lifts because this day and age, neuromodulators like Botox and Dysport can nearly prevent aging of the forehead and around the eyes. So the aging process then really takes effect of the lower face and neck. And another thing other than age that's really affecting a lot of people is massive weight loss, whether that's through bariatric surgery or through the GLP-1 medications like Ozempic, leading to a deflated amount of skin in the lower neck and hanging skin here. That's why I like neck lift, because so many people are looking for a change to their neckline to look great in shirts, to feel confident going out, for men to feel like they have a nice masculine jawline. And it's a very easy procedure to recover from. And there's minimal scars. They go oftentimes around the ears and just hidden under the chin here in the submental crease. And as I mentioned before, recovery is very short for a drastic change in your face. As we age, the hardness of the face tend to go down. They lead to jowls and they square out the face. But through a neck lift, we can rejuvenate the jawline, making the whole lower half of your face feel much younger. And while we can do drastic results, I love natural looking results. So just a touch of rejuvenation here, tighten the area underneath the neck, define the gonial angle here, this jawline, and make you feel much younger.
Hi everyone, my name is Dr. Rachel Park and I am a plastic surgeon in Northern Virginia. Today we'll be talking about double eyelid surgery. So let's start with what is double eyelid surgery. It is a surgical procedure where a surgeon removes excess tissue of the upper eyelid and also create the double eyelid by forming a well-defined upper eyelid crease. This can significantly increase your eye aperture or make your eyes bigger, creating an overall look of more alertness and a softer image. This procedure can also slightly evert the upper eyelashes and prevent them from irritating your cornea. It can also make the eyelashes longer as well. This procedure is often referred to as Asian blepharoplasty or Asian double eyelid surgery as well. So who is a good candidate for this procedure? Patients without upper eyelid folds, small eye opening or aperture, and bulky or heavy upper eyelids may benefit from this procedure. Some patients will even talk about how their upper eyelashes curl inward, therefore irritating their eyes. This procedure most frequently benefits people of Asian heritage because of their characteristic phenotype. Compared to Caucasians, Asian people generally have thicker skin, more eyelid muscle, and bulkier upper eyelid fat pad that kind of protrudes even further. You can see in this picture of an example, a stereotypical Asian upper eyelid. Again, with thick skin, heavy or bulky appearing upper eyelid with protruding fat pad. You can see that the distance between her medial canthus, or between the inner corners of her eyes, are quite wide. In addition, you can barely see her upper eyelashes. They are sort of buried inward, often irritating her cornea. Common complaints in these situations are both aesthetic and functional. Again, sleepy, tired-looking eyes, and feeling of heaviness of the upper eyelid, as well as frequent corneal irritation from the eyelashes. Additionally, the lack of upper eyelid crease is caused by the way that a typical Asian person's upper eyelid muscle interacts with the eyelid skin differently than that of Caucasians. This mechanistically translates to lack of upper eyelid crease. So what will the surgery achieve? This particular surgery will aim to achieve the following things for both aesthetic and functional reasons. First is the creation of the upper eyelid crease. Ideally, the crease will start from the inner corner of your eye, follow the natural curvature of the eyelid, and then taper off at the outer corner of the eye. This crease should not look puffy or swollen once the post of swelling goes away. Permanent or long-lasting puffiness is a common complaint after procedures like this, and the way that I address this ahead of time is by removing enough excessive muscle and fat during the time of surgery. Second is epicantoplasty, or removal of so-called Mongolian folds. So Mongolian folds are the excess skin webbing of the inner corners of the eyes, and this particular feature can make your eyes look farther apart by making the distance between the inner corners of the eye longer. By performing epicantoplasty, your eyes will appear longer and better defined. Third is upper eyelash repositioning. This procedure should evert the upper eyelashes, which prevents them from irritating the cornea. This also makes your eyelashes appear longer and also makes it easier for you to apply mascara. Fourth is an increase in your eye aperture. In other words, your eyes will be bigger. This is achieved by allowing more of your iris to show. So I will aim for your eyelids to sit just above your upper limbus, or covering just the top of your iris at rest. Lastly, I will close the surgical site the plastic surgery way, meaning with minimal scarring. I use very tiny sutures to close the incisions. In fact, they're so small that I use them for microsurgery or to sew up tiny blood vessels. This meticulous closure allows your incision to heal well with minimal scarring. Your suture will be mostly buried underneath your skin, and this will prevent any railroad tracking and also minimize any skin irregularity along the incision. Now, here's a real-life example of a patient who underwent Asian blepharoplasty. Please note that this is not my own patient, but this is a patient of my mentor who uses the same technique. So again, you can see heavy appearing, bulky upper eyelids without any upper eyelid crease, and you can barely see her upper eyelashes here. You can also appreciate her Mongolian folds, making the distance between her inner corners of the eyes look wider. Lastly, you can also see that because of the lack of the fold, she has more than 2 millimeters of the upper lid covering the top of her iris, creating some asymmetry. After the procedure, you can appreciate a clear, well-defined fold extending from the inner corner of her eye, naturally tapering off laterally. You can also see the effect of epicantoplasty here. It helped increase the width of her eyes and therefore decreasing the distance between the inner corners of her eyes. Most of her iris is now showing, with the upper lid covering just the top of her iris. You can now see the repositioned upper eyelid lashes, which are slightly everted and not poking into her cornea. Also note that our upper lid folds do not appear swollen. What happens during the surgery? In most cases, this is a simple procedure that can be done in an office setting. I will use local numbing medication, and that will be the worst part of it all. You will feel some slight pinch at the time of injection, but afterwards you should be pain-free. Before the actual surgery, I will sit with you and decide on the height of your upper eyelid fold that suits you the best. The goal is to give you a single, smooth crease that spans the entire length of your eye, starting from the very inner corner of your eye to the outer corner. During the surgery, I will remove excess skin, muscle, and fat that is responsible for heavy appearing upper eyelids with small eye aperture. The removal of the muscle will help minimize the prolonged swollen look after the surgery. I will then place some key sutures that will not only create but also maintain the fold permanently. When applicable, I will also perform medial epicantoplasty, which will again increase the length of your eyes and also decrease the distance between your inner corners, better defining your eyes. I will then close the incision with very small suture, which is often used to sew tiny blood vessels. The suture will leave no railroad tracks or skin dimpling, and they will be removed in clinic in about 5 to 7 days. What is post-op recovery like? After the surgery, you will receive a very detailed instruction on how to care for your surgical site and minimize swelling. After about 3 to 5 days, you may feel comfortable leaving the house with a pair of sunglasses. After your suture gets removed in about a week, most people feel comfortable returning to work. After 14 days, you will start wearing light eye makeup and feel more confident in social settings. You can also start gently washing your periorbita or around the eye and getting everything wet. You can start getting back to your exercise routine at this time as well. Asian blepharoplasty may seem like a common procedure that a lot of surgeons offer, but I do believe that in order for you to achieve outstanding results, it requires a specialized surgical skill as well as a nuanced understanding of the culture. And I'm confident that I can be that surgeon for you. And I look forward to seeing you soon and being part of your personal journey.
So what does the process look like for you? First, you reach out to our office and you schedule a consultation at a time that works well for you. You can come see me in Tyson's on Tuesday or at the Reston office on Thursday. Consultations usually last around 30 minutes, sometimes a little bit more, sometimes a little bit less. But during that time, we talk about your goals, your health history, what surgeries you've had in the past. We'll take pictures, and then I'll talk to you about the different options that you have available to you and how to reach your goals. Following that, a surgical coordinator will reach out to you to discuss what works within your life. Sometimes during this process between the first consultation and when the surgical reaches out to you, questions arise. So you're more than welcome to come back in or reach out to me via email if you have any questions, and I'd love to discuss those with you. After you decide on your perfect surgical date, our office will be in touch with instructions on how to get a preoperative visit with your primary care doctor. It's best if you go to your primary care doctor and not an urgent care clinic because your primary care doctor knows you best. At that appointment, they're going to go over medication management around the time of surgery. So if you have to stop certain medications a week before surgery, they'll discuss that with you. And they'll do routine labs and a physical exam and provide our office with clearance for surgery. Another appointment that you have before surgery is to come back and see me. So I often have patients come in for a quick preoperative visit just to make sure that we're on the same page, nothing has changed, that we have all of our medication plan, teed away, that you have the appropriate tools at your disposal for the best possible recovery process, and then to answer any additional questions that might have come up. Then the day before surgery, even if it's on a Monday, I'll give you a call on a Sunday and make sure that all your questions are answered and you're feeling great for the day of surgery, because I'm always pumped going into surgery and I want you feeling excited as well. So then I'll see you on the day of surgery. After surgery, I check on you in the recovery area. I'll call your family member, friend, or loved one who's with you and just let them know everything went great and answer any of their questions. And then I give you a call that following day after surgery. For facial procedures, you'll often come back into the office the day after surgery, sometimes to remove drains and remove dressings. Other procedures, the first follow-up really isn't until a week after surgery. Surgery has its own pathway for recovery. But in general, usually the first follow-up is either at a day for facial procedures, and then for all other procedures at a week after surgery, then 1 month, then 3 months, then 6 months, and a year. Why is that? Because the scar is maturing over a full year's time. So we want to make sure that that scar is healing perfectly, and there's nothing we can do either through a steroid injection, laser treatment, or anything else to optimize that healing process for you and answer any questions. So that's what it looks like for you. I know that you're going to enjoy the process, and I'm right here with you every step of the way.
Hey everyone, Dr. Park here. Lost a lot of weight, but left with a lot of loose skin? Well, body contouring surgery might be your next step. After major weight loss, whether through bariatric surgery or medication or just plain old diet and exercise, no matter how many push-ups, pull-ups, or squats that you do, you may be left with stubborn loose skin that you can't seem to get rid of. Well, weight loss surgery or body contouring surgery may be able to help with that. Common procedures will include things like tummy tuck, arm lift, thigh lift, or lower body lifts. And some of these procedures actually can be combined into a single surgery. The key is being at a stable weight for at least 6 months, having realistic expectations, and having good nutrition and being in good medical standpoint. These are transformative, very powerful surgeries, but they will result in visible scars, but they're placed very strategically and they will fade significantly over time. Recoveries will vary by procedure, but typically it takes about 6 weeks for one to get back to their routine exercise. Body contouring isn't about replacing the hard work of losing the weight. Rather, it's a finishing touch to help you complete your weight loss journey and to help you feel a little bit more comfortable in your own skin. You've done the hard work of losing the weight, be proud of it, and if you want help, I'm here for it.